Good morning. I want to wrap up a little bit with personality disorders. We just have like a few other thoughts. And then, as I told you, we are going to start a film that will take us 2 classes and will be a really great opportunity for you to practice for the final paper that's due next week, Rick. I'm gonna keep putting it up there. I'm gonna keep reminding you. And as I mentioned last class, if you want to send me a rough draft, just make sure that you do that before the end of Monday. That way I have enough time to read it and get back to you with some feedback. But a couple of you have already done that, bless you, which I think is amazing. But either way, it's due next Wednesday, 1 week from today. And my goal with the movie is to get you practicing that. And I think it's also a really great way to talk about chapter 14, but just a few things left here before we keep going. Any other questions about the paper or anything from last time before I jump back in, just to make sure? Okay. So we talked about all of the different personality disorders, right? There are 10 of them. And when it comes to causes, right, it's probably not a surprise. It's a combination of factors, right? Just like with anything else that we've talked about. But there's this interesting perspective called the like psychopathological perspective that we sometimes go into when it comes to personality disorders, where we say that everything builds on what came before it, right? So it's kind of like a perfect storm in a way that creates these disorders. It's thought to be a combination of a bunch of different things. And I should probably reorder these to make more sense, but it's thought that like people are born with like a biological predisposition to getting that personality disorder. So their genetics are playing a role shaping their neurotransmitters and like balance of neurotransmitters. And so then what happens is they're born with that predisposition in place, right? Which leads to certain behaviors which become conditioned, which leads to responses from like parents and during early childhood, which leads to deficiencies in thinking, which leads to cultural and like interactive pieces down below. It's like everything just kind of snowballs in a sense. So there's thought to be a genetic component to some of these, but then the environment kind of either activates that or doesn't activate that, depending on the behaviors and the way that a person is raised. Some of the disorders, like some of the personality disorders that we covered, have more like specific triggers than others. For example, borderline personality disorder tends to have really strong roots in like early childhood stuff, right? So maybe abandonment during early childhood, or maybe that could be divorce or the loss of a parent or the loss of someone like prominent in your life leads to that fear of abandonment when you're older. So that one, for example, has that as like a bigger component. And then antisocial personality disorder tends to have a lot of behavioral stuff. Thank you. You actually have to have a lot of like acting out and defying like rules and things like that as a young child. And then it just kind of builds from there. So the causes of this are really complicated, just kind of like the disorders themselves. And they're complicated to treat. Therapy proposes a lot of like, it has a lot of issues that go with it. And we kind of touched on this a little bit, I think it was last time, that each one of the disorders tends to have issues with therapy, right? The dependent personality disorder individual might kind of end up like Bob and be very dependent on their therapist and not be able to, like make any decisions or do anything without them. The antisocial personality disorder individual might manipulate and like harm their therapist in some way. The narcissistic individual is going to believe they know more than the therapist, right? Like each one of them kind of has barriers that come with it, right? Paranoid isn't going to trust their therapist, right? Each one has little obstacles that might sort of get in the way. And a lot of people with personality disorders don't necessarily go to therapy, right? They might just think it's their personality. It's who I am. Like it's everything about me. Or maybe they don't even think it's problematic. People who have like narcissistic or histrionic might not realize that they have a disorder that needs help, right? They might think other people need help, not them. And so when people do get into therapy, the idea is to work on whatever skills you are deficient in, right? So if you're not great at empathy, let's work on empathy training. If you're not great at making decisions on your own, let's work on pushing you to make some of your own decisions. So it's oftentimes trying to like challenge any beliefs or inappropriate thinking patterns, trying to teach better like concrete skills. If you tend to be really hypersensitive to negative evaluation, let's work on interpreting the things that people say and checking the facts as a way to kind of balance that. So we might do things like medications if we're treating underlying issues, but oftentimes it's a lot of like training in whatever skill you are lacking, right? And then maybe even exposure treatments of kind of having people go out and practice these skills and write about it and work on it, right? And as I mentioned with borderline personality disorder, for example, we have things like DBT, right? Where we're working on very specific skills to challenge your thinking and kind of rein those emotions back in. So treatment for these tends to be tricky, right? In essence, again, we're saying your entire personality is the disorder. It's very difficult to change your personality. Your personality is enduring, it's who you are. And the people in your life and the things that happen can shape it a little bit. But to completely change your personality isn't really something that is overly possible to do, right? Or to make it last anyway. You might have some changes, but more so focusing on the skills that you're lacking as a way to make it easier for you to like interact with others and live your day-to-day life. A lot of barriers to treatment. And again, sometimes medication can be helpful. Like if somebody has a lot of anxiety or maybe a lot of like low mood, but for the most part, it's just like skill training and kind of learning to deal with everyday sort of stuff. And we've talked about this all the way throughout too, that there are a lot of problems with these disorders. They're probably the most controversial of all the disorders that we're talking about this semester, right? They're often misdiagnosed. People very wildly and like their judgments with these, or widely or wildly, both are true, right? It often is the case that somebody with one of these personality disorders, they could go to 5 different therapists and get 5 different diagnoses, right? Or you could have 2 people who both have the same personality disorder and they get diagnosed differently, right? And oftentimes there's so much similarity, especially within clusters, that it tends to be problematic. They can be hard to tell apart, right? Which we've talked about, like some keywords for each one, but there's so much overlap. And then people don't always fit neatly into one. And a couple of you have asked this, like I've gotten it via email and then also in here. Again, we try to only diagnose one of them, but it might be that you don't fit into any of them neatly. And that's another big issue with these. So some places have tried to look at, are there better ways to classify personality disorders? In Europe, they use a system called the ICD, the International Classification of Diseases. So we use the DSM, they use the ICD, and they do it a little bit differently over there. They talk about personality as it relates to the big 5 personality traits, like conscientiousness, agreeableness, neuroticism, and so on. And so they look at it in a very different way. And so there's a lot of research being done on this. It wouldn't surprise me if at some point, not in the DSM-5 text revision that just came out, but maybe in the DSM-6 or like 7 someday, it wouldn't surprise me if this whole category gets like a huge overhaul at some point, because it really is, again, probably the most problematic because there's so many issues like these and the ones that we've talked about. So they're commonly diagnosed disorders. There are a lot of them. There are 10 of them. A lot of your characters, a lot of you think that your character has one of these, but definitely far from perfect, a little bit difficult to treat and sometimes difficult to identify as well. Are there any other lingering like thoughts, questions, comments, stories? Yeah, anything? Yeah.
So then to personality disorders, even though it's a different cluster.
Yeah, you shouldn't, right? So the idea is that your personality is everything about you, right? So if you have more than one, in essence, we're sort of saying that you have more than one personality, right? In which case, then you would almost qualify for like a dissociative identity disorder, like diagnosis. So if you don't fit neatly into one, they would give you like personality disorder not otherwise specified. And then they kind of like specify what symptoms and features you have. But typically we try to keep it to one. I won't say it's like a hard rule, but it's really discouraged from diagnosing more than one. Just by the nature of the disorder, you should only have one.
another disorder.
Like depression or
Yeah.
anxiety. Yeah, for sure. You just can't have more than one personality disorder. Otherwise, we're saying you have more than one personality. Because they tend to be all encompassing. So having more than one would indicate, and it would indicate that. Anything else here? Any other questions, comments, thoughts, anything? Anything else? Here? Our next chapter is chapter 14. So we're going to look at disorders of childhood, and then we'll look at disorders of aging, and then we go into forensic psych. That's it. 3 chapters left, right? Try not to get ahead of myself. That seems sad, right? So we'll focus on one at a time, right? Mindfulness, one at a time. So chapter 14, these are disorders that are related to people who are younger, right? People who are kids, and then also through the teenage years. And so rather than lecture about this in a traditional way, we're going to do kind of a more flipped way. I'm going to show you the film that I talked about last time. So the film is What's Eating Gilbert Grape. I'm going to hand around this worksheet that you're going to fill out as we watch the movie. Please fill this out during the movie. Don't have this be homework. It doesn't need to be homework. You don't need more homework. So work on this during the film. That way you don't have to take it home with you. If for some reason you miss Monday, I will be posting a link to the film on Canvas, or you can obviously find it anywhere. But if you miss for some reason, make sure you finish this up on Monday. I won't be collecting it until probably Wednesday next week, when we go ahead and talk about it. Y'all be great. So as we're going through the film, what I want you to focus on, especially today, you're like full focus today should be number 2. Okay, so number 1 is just kind of like your own personal reaction. But as we're going through the film, Arnie, who's played by young Leonardo DiCaprio, is the character that you're focusing on diagnosing. Now, I don't expect that you can diagnose him today. Maybe that's something you focus on more on Monday. But for today, make a bulleted list of everything that you see that's like a symptom or a sign that he might have something going on. There are lots of them, right? You should at least get like 15 bullets down here, right? There's a lot. So your answers to these are more than welcome to be bulleted, but work on it during the film so that you don't have to take it home with you. And we'll go until we have like a minute or 2 left. I'll stop and then we'll pick up with it when I see you on Monday. Okay, I'll leave these up here in case you need an extra copy for any reason. Let me bring this up. So I'll hit the lights, but stay with me. Okay, and I put the captions on as well so that hopefully that's helpful. I hardly ever watch anything without the captions anymore. All right. Okay, here we go. Maybe.
Chicken.